Heavy is the head that has to manage all of this.
Hey everyone, welcome back to my channel.
We're now incentivized to buy what we already buy.
Fumbling through college had me building.
I also got something done on the other side.
And that was right around, I would say, May, maybe, right before renewing the lease for this property.
Welcome to the channel, Martha.
Thank you for having me here.
Oh, I was going to say, I am getting up in their names, I'll tell you what.
Bills paid by other people, life was never this good. I had to step back, knowing that it's...
Hey everyone, welcome back to the channel. So today I want to talk about the United Healthcare CEO, Brian Thompson, being shot and killed in New York City by Luigi Manioni. And so, you know, there was a poll that came out. It was 41% of young voters find killing the United Healthcare CEO acceptable. It was actually a little bit more than that. More than 41% of young voters found the killing to be acceptable. Now, to my surprise, no one talked about why people found it acceptable. They only spoke to the killing, which should be addressed, right? Because we don't want people to go on killing sprees, going after the rich and killing the rich, right? And these media outlets that work for the rich obviously are going to be erring on the side of caution. But the everyday American, the everyday person, I used to work in the healthcare industry, so I absolutely understand the frustration and the heartbreak that comes with your husband, your wife, your daughter, your brother, your sister, your whatever, your son, being in a critical condition. And then not only are you having to be by their side, skipping work, not able to work because you want to spend whatever time you have with your loved one, you then also have to worry about insurance and whether they're going to cover this procedure, whether you're able to speak on their behalf, all these legal ramifications that may come about when trying to simply support the person that you care for. You know, I've been able to give guidance, resources, all these things to support people in the healthcare system, but healthcare should not be like finance, right? I've been talking about finance for years because I understand how important it is. I understand how complicated it can be, and I understand that not many people care for it. And to be honest, some people may never know a thing about finance and still be able to get through life. Now, will you be able to live your best life? Probably not, but you'll be able to get through life without knowing a lick of finance. But can you get through life without knowing a lick of healthcare? It is probably not probable, especially in America today. And the reason for that is because of all of the hurdles that you must come across, prior authorizations, making sure that you're insured with certain providers, going out of network and having different costs or no coverage whatsoever. All these things that come about when dealing with insurances, and then simply not even being covered for certain services until you meet a deductible or an out-of-pocket maximum. Right? There are some people who pay 100% until their out-of-pocket max is met. Therefore, you essentially have no deductible. Because if you have to reach 100% of your out-of-pocket max before anything is paid, you essentially have no deductible. If your deductible is $5,000 and your out-of-pocket max is $5,000, you have no deductible. That's essentially what it is, right? And so I know I'm speaking gibberish to a lot of people right now, but again, working in that healthcare industry, I understand the frustrations that people go through, what they can't afford, and the fact that some people must forego healthcare or even drop their son, daughter, significant other off of their coverage because they simply can't afford to do so while paying other important bills like mortgages, rent, and car notes so that they're able to get to work and make money. And so America has been slipping out of control. And the number one reason for financial distress in America today is healthcare. Healthcare is the number one killer of financial assets. And so when Leo Mangione, or Luigi Mangione, shoots the healthcare CEO, God rest his soul, and condolences to his family, the bigger corporations, the CNNs, the NBCs, the Fox News, they all neglect what the masses are feeling. Essentially, what I've been seeing is if someone shot and killed a serial killer, would you be mad? Would you be upset? Or would you say thank you for getting this serial killer off of the streets? United Healthcare denies 1/3 of all of their claims, more than any other health insurance in the entire world today. In all of America, United Healthcare, as big as they are, denies more claims than anyone else. They are the number one biggest serial killer in America today. And Brian Thompson was their leader who brought in record-breaking profits 2 years in a row at the minimum. Therefore, denying more people than ever before in the history of United Healthcare, requiring more prior authorizations, requiring more information, requiring more checks from doctors, referrals, this and that, and second guesses and second opinions and all these other things prior to receiving care. I can tell you from experience helping other people that the worst the worst thing to get coverage on is medical devices, medical equipment, and big surgeries of any kind. Big surgeries of any kind and medical devices. Everyone wants that electric motorized scooter. They're not getting it. And I don't know why it's called a scooter. It's almost like a motorcycle. It's almost like a moped that these people use to drive around. But they all want it motorized and they can never get it. They can never get it. They'd rather you be in a wheelchair for the rest of your life. You already lost your legs. You want to find a little bit of joy by getting a motorized vehicle to drive you around and not feel completely dependent on people or completely dependent on your arms at all times. They'll tell you no. And I to me, it's not personally too expensive. $1,700, $1,600. You could at least put a time frame on it. You can't get another one for 5 years, 6 years, 7 years. But no, they don't even want you to get a motorized scooter. And so those are the people dealing with all those frustrations after losing a leg, after losing so much already. No wonder someone will be willing to sit outside, leave their state to go to New York probably for the first time in their life and wait in the cold or in a hostel for a CEO to go and celebrate success, the death of millions of Americans every single year. Nobody wants to talk about that. The healthcare system has been in shambles for far too long. Far too long. The food that is allowed in our country, the neglect of exercising and working out. America is one of the biggest countries in the world, the most obese country in the world. There's nobody who eats as unhealthy as Americans. You go to other countries and they always talk about how natural their food is, how you can eat so much and never feel bloated. I just came back from the gym. My arms are swollen, they hurt, they're aching. And I still feel as though the food that I put into my system, although I cook very often, is still very detrimental to me. All the salts, sugars, and oil, and preservatives, artificial flavor. Imagine reading a label that says natural flavoring. What does that even mean? What does natural flavoring even mean? Right? And so as much as you try, there's always going to be something to set you back here in America today. Everything is fake about what we're putting into our bodies. And so I want to speak for the people. I want to speak for the people. These companies, these corporations, they're serial killers, allowed to treat us each and every single way because these Americans who are paying for their success simply do not have the money to fight back in any other way or capacity. Would anyone else go out there and shoot a CEO? Probably not. But I can absolutely understand why they would not feel any remorse when their claims are being denied, when their loved ones are foregoing health care, walking around with bad hips, bad legs, and bad backs because they don't want to see that bill, because they can't afford it. It's a sad world that we live in where people have to constantly deal with their aches and pains for 10, 20, 30 years because they simply don't want to see what that bill will be. If you like this video, make sure you leave a like, comment, and subscribe to the channel. Make sure you share this with somebody who is going through a tough time to let them know that they are not alone, that we understand, that you understand. And I will see you on the next one. Peace.